Hey team, this is Joe Johnson with Cardinal Health, and today we're going to talk about the ENFit conversion phase 1. And in phase 1, we're going to be looking at converting our adult nasogastric feeding tubes and their extension sets along with G tubes. Those are the only items that we're going to convert, so we'll talk about those. We'll talk about the brush, the different connectors, as well as our feeding pump. Now over here we have a non-ENFit, or what we would consider a legacy feeding tube, which is basically the connection that we're all accustomed to. It's just an opening, right? Compared to an ENFit feeding tube, which now has a small moat on the outside as well as that center line there. So the anatomy does change a little bit. Referring to the pump sets, another change that we did make was a packaging change. So we no longer include that white transition connector in the packaging and connected to our enteral pump feeding sets for the E-pump and the Joey. That is still available, still works in the same fashion. It just needs to be purchased separately. Okay, and that is going to be primarily utilized to hook up our ENFit compatible feeding pump sets directly to a legacy feeding tube like this, whether it's a G tube or small bore nasogastric feeding tube. When it comes to the actual tubes themselves and those ENFit tubes, well, connecting our feeding pump is really simple. So that goes straight in, and that's a soft quarter twist until it stops. You don't want to over tighten it, just like that. Well, again, whether it's the G tube or if you're talking about your small bore nasogastric feeding tube. However, if we needed to use a standard syringe, and we will for this conversion, because ENFit syringes aren't fully available yet, still going to be necessary to use this not only with this product, but also with some of the legacy product you guys are using. You're going to need to use something called a reverse funnel connector. This basically is going to change that port over there from being a ENFit port back over to a legacy port. So now we can utilize our standard tip syringes, catheter syringes, and insert there to do medication and things of that nature. So that's going to be the main use for that. And that is going to go for whether it's the G tube or that small bore nasogastric feeding tube. Now, GEDSA, which is the Global Enteral Device Suppliers Association, which comprises basically of all the major manufacturers and the FDA, we're the ones that came up with the ENFit feeding port, right? And changed the way this was, really to focus on safety and to avoid misconnections. One of the things that GEDSA recommends is that we do a visual inspection of these ports at least once a day. So you want to check in there and see if there's any nutrition sitting in that moat area. Reason being that stuff firms up when it sits for a while and can become really difficult to disengage this connection. Since we don't want to crack that connection, we do recommend, if you do see anything in there, to use our EnClean or a brush of some sort to clean out that area. What we're going to do is you can definitely irrigate that location to kind of release any of the matter that's in there and soften it up. We'll take our brush, we'll dip that in some water, and we're going to go ahead and basically swipe around that outside of that moat and then in that center line just to kind of clear it out. And that's pretty much it. So again, we talked about needing to use the brushes for daily maintenance and, inspecting those ports. We talked about the transition connector, really just for your pump set to connect back to that legacy feeding line on a legacy patient set, whether that's a patient coming in with it or if that's some of the competitive product that you guys currently use. And we also talked about the reverse funnel connector, which can be used on the medication port, and a change in ENFit feeding port or medication port back over into a legacy connection. So again, this is Joe with Cardinal Health. I thank you guys so much for your time and looking forward to subsequent phases. Take care.